Today, as we start our third webinar series for the research, may I call on Dr. Hazel Ann Catublas to introduce our guest speaker.
Hello, good afternoon. It is my pleasure to present to you our esteemed speaker this afternoon. He is a graduate of Bachelor of Science in Nursing from Chinese General Hospital Colleges and obtained his Master of Arts in Nursing from the University of Santo Tomas. He obtained his Doctor of Philosophy in Education with specialization in Educational Leadership from Adamson University last 2019 and a recipient of Meritissimus Award. Currently, he is affiliated with various education institutions such as the Chinese General Hospital Colleges as a professor of undergraduate students in the subjects of nursing leadership, research, informatics, and bioethics. He is also the Research and Community Extension Officer of the said college. He is also teaching in the College of Nursing and the Graduate School of Adamson University, handling master's and doctorate levels in the field of research, educational ethics, and educational technology. His research interests include that of nursing and health science education. He had published several researches on the said field and presented papers both locally and internationally. So without further ado, let us welcome with a virtual round of applause, Dr. Ryan Ray Gatbonton.
Good afternoon, everyone. Thank you for the nice introduction from Doc Hazel. Thank you for inviting me for this for your webinar series. So I am tasked to talk about descriptive research, no, in most especially in health sciences. So I'll be presenting my slide. All right, so can you see my PowerPoint presentation?
Yes po, Doc.
Okay, so for today, I'm again tasked to talk about descriptive research in healthcare. No, I was told that pharmacists, no, are majority ang mga study ninyo are at the experimental level. Okay, but for today, because sabi nga sa akin at the context, uh, the pandemic has caused us to rethink, no, of some other ways we can do research, no, without exposing ourselves unnecessarily, no, to the virus, no, to the coronavirus. So I'm here to talk about some other types of research that may be useful for the College of Pharmacy students, no, to consider, no, for your research topic. Okay? So today we will discuss the descriptive research designs. But before we go with the different descriptive research designs, okay, let's have a short review of our research concepts. No, I know I was told also that some of you this is your first time, no, to encounter research, no, in the collegiate level, or some of you are or did their research way back in senior high school. Well, some of you are also familiar, but some others may not be so familiar. So let's have a quick review of research concepts. We always say that research is a systematic inquiry that uses disciplined methods to answer questions or solve problems. No, when we say we do research, we find answers. No, we find solutions. We find something new out of what is known. Okay, our everyday lives is actually research in itself. Okay, like for example, you're trying to decide what to eat for lunch, no, or deciding what to eat, no, is merienda, no, or sa gabi for the dinner. Sometimes you also do research when you try to find the best laptop specifications for your online learning. No, that's research in itself because you try to find out what's best for you, what suits you, what fits your need. So therefore, you do research every day. Doing research every day is actually similar, no? Similar with disciplined research. Now, when we say disciplined research, this is the inquiry in itself, no? Inquiry in our own discipline. Me for nursing, you for pharmacy, no? So when you do research in terms of your related profession, you are doing a disciplined research. Your everyday research is similar, no? Similar with your disciplined research. Okay? Yun nga lang, you're following some certain rigorous steps. Okay? Nagre-literature review ka, no? Those are the things that you do when you do systematic inquiry. Okay? Or sorry, when you're doing disciplined research. Okay? Now, when you do research, no, and if you have come across when you come across in your webinar series, no, nakaka-encounter kayo ng mga salitang variables. Okay? Mga those are the we say that those are the building blocks of research. Okay? Yung mga variables, pag-aaralan ninyo kung ano yung relationship niya with each other, no? Minsan tinitingnan mo rin yung cause and effect relationships, no? So, yun yung mga bagay na pinag-aaralan natin, no? That we study in research. Okay? Now, why am I saying this? Because for us to understand what descriptive research is, we have to be familiar with variables, no? Manipulation, or what and other mechanisms, no? Technically, we will focus on what variables we need to study, and also are we introducing a manipulation, no? Common in pharmacy studies are manipulation, no? Are the inclusion of manipulation or the inclusion of an intervention, no? Example, magbibigay ka ng certain drug, no, to know the effect, no, on mice or whatsoever. That's an experimental research. Okay? Because you try to introduce a new, no, or a novel approach or a treatment to a group of people, and then try to examine what's the effect. Okay? So that's the common, okay? Common research design. The least, no, yung medyo hindi na-explore na aspect, no, ng research in terms of pharmacy is what you call your descriptive designs. Because in descriptive designs, okay, these are broad non-experimental researches. No? When we say non-experimental, you do not introduce some intervention, no, to experiment on. You're just there to explore. You're just there to identify, to describe, to explain, no, the extent, no, ng inoobserbahan mo. Okay? Ano ba yung mga inoobserbahan mo kapag ikaw ay nagre-research? No, in descriptive research, inoobserbahan mo yung characteristics, prevalence ng isang bagay, intensity, kung gaano siya katindi, or the full nature of the phenomena. Okay? It's like you're answering the questions what, where, how this happened, no? What is the extent, no? How is it interpreted by the people around us, no? Descriptive research goes on that paradigm, no? We try to understand the things around us. Okay? Now, descriptive research actually occupy the first level of research, no? Kasi in researches, we try to define, no? We try to define research based on their types or their levels, no? Pag level 1 researches, these are researches, yun nga, sabi natin, that answers the question who, when, where, why, how, no? It's like you're describing. You're not comparing any variables. You're not associating any variables. So you're just trying to understand, explore, no, describe, no, your phenomena. So that's your level 1 researches. Next to that level is yung tinatawag nating level 2 researches or your correlation or comparison, which involves correlation and comparison. When we say correlation, we try to connect, no? We try to find association between two variables, no? Two or three or more variables. For example, no? You try to find the relationship between your weight and your blood pressure, no? You're not doing anything, no? You're just naturally observing it, but you're trying to correlate two variables at the same time. So that's one. Another type of level 2 research is when we compare, no, outcomes. For example, no, we want to know whether a certain drug, no, being taken by two groups of people, we compare, no, the effects on them. So that's a comparative research. That's level 2 research. Okay? So the third level, no, the third level is the highest level, no, in terms of determining causal relationship. And these are your experimental researches, and the more rigorous one, yung tinatawag nating randomized control trials or yung tinatawag nating RCTs. Okay? Now, experimental researches are those, no, that take on the true form of experiment research, no? Experimental research in true form. Meron siyang elements of randomization, meron din siyang elements of control group, at may element din ng manipulation or introduction of an intervention. Now, sabi natin, we identify level 3 as the strongest, no? As the strongest source of causal relationship para ma-prove yung causal relationship. No? So, we can say na ang level 1 ba ay hindi na rin katanggap-tanggap and not really acceptable form of research? The answer is no. Okay? Because some researches, no, some experimental research, bago yan maging experimental research, dumadaan muna yan sa pagiging descriptive. No? So, determining, for example, no, if you're in the COVID vaccine stage, no, determining the the safe dose, no, for a particular drug, in a sense, that's a descriptive because you determine something. No? It starts with descriptive studies and then nag-evolve towards level 3 study. So therefore, we cannot say that descriptive studies are walang kwenta, no? Are hindi naman katanggap-tanggap, no? But then it's also a building block kasi, no, of further complicated studies. So that's why it's also important, no, to discuss or to consider descriptive studies. Okay? Now, yun na nga, sabi natin. So, that's one reason why we do descriptive research, no? Because number one, it's a building block for more complicated studies. No? But there are also a number of reasons why we need to do descriptive research. So, what's the first one? The first one is that a vast number of characteristics are inherently not subject to experimental manipulation. Ibig sabihin, there are innate human characteristics that we cannot actually modify. No? We cannot actually manipulate. For example, we cannot manipulate the person's blood type. We cannot manipulate their eye color. We cannot manipulate their behaviors. No? In a sense, no? Because those are innate characteristics na mahirap baguhin. No? So we tend to change our paradigm in research. We try to change into a descriptive research so that it's more realistic. No? Realistic sa pagkuha ng data at sa pag-analyze ng data. Number 2 reason. There are many variables that could technically be manipulated but could not be manipulated ethically. Okay? So, well, there are a lot of variables, no, na pwede nating i-manipulate. Yun nga lang, kapag minanipulate mo siya, there's a problem, no, with ethics. Like for example, no, you want to explore infant mortality in a certain group of people. No? So you try to identify the factors if it will cause infant mortality. No? Like for example, babawasan mo yung health center sa isang lugar. Okay? Ang tanong, will that be ethically acceptable to remove, no, an existing health center in a community? The answer is no. That's not ethically acceptable because you remove the service that they had already. No? So if you manipulated the health center, you introduced harm to that group of people. No? You remove their access to healthcare. So that becomes unethical because you violated the principle of non-maleficence. You caused harm to them. So therefore, it's not ethically possible. So you have to result in natural observation, no, for the variable infant mortality. Okay? So another example, no? You want to know yung ginawa ng mga Nazis, no, on the um, ng mga Nazis doon sa mga prisoners of war, no? One research is yung tinatawag na freezing vat, no? Kung saan yung prisoner of war, no, with a thermometer in their rectum, yeah, they will be submerged, no, into a freezing batya ng tubig, no. Lulubog sila ron sa drum ng tubig until mamatay, no? And then they will record the data, no, the lowest temperature that they still have signs of life, no? So they found out it's around 25. But that in itself, that experiment in itself is unethical because you introduced an intervention that harms your respondents or your human subjects. So therefore, it cannot be ethically acceptable, no? Pero ginawa nila. Kaya nga nagkaroon tayo ng Nuremberg Code dahil nga doon sa mga atrocities, no, in research during the Nazi period. So going back, you cannot just manipulate, no, a variable, no, because it's unethically acceptable. No? It's unacceptable pala rather. It's ethically not acceptable to manipulate, no, the variable. Okay? Number 3, the third reason why we do descriptive research is that there are many situations in which it is simply not practical to conduct a true experiment. Sa madaling salita, wala tayong kakayahan na gumawa ng true experiment. Because there are some factors that may affect how we do or conduct a true experiment, no? Number 1 dyan, yung pondo, the funds. If you do not have the funds, no, to conduct a true experiment, no, kasi it entails a lot of expenses kapag ikaw ay nag-true experiment, no? For example, nag-true experiment ka, nag-recruit ka ng mga tao, etc. Mas inabala mo sila sa trabaho nila, tapos nagkaroon ng aberya during the experiment, lahat yun sasagutin mo, no? But then sometimes we do not get the funds, no, to support our research. So we may have to resort to descriptive, no, research where the risks, the expenses, no, are a little bit lower, no? Are a little bit lower. Okay? So sometimes, no, there are some research questions talaga na which cannot take on an experimental design. Hindi appropriate yung experimental design para sa isang research mo. For example, you're observing behavior, no? If you will manipulate other people, no, for their behavior without their consent, no, that will be inappropriate. So you have to how do I say this? You have to modify your research, no, from experimental, no, into a less invasive procedure like your descriptive research. Now, obserbahan mo na lang sila naturally. Okay? Now, sabi nga natin kanina, non-experimental research is usually needed before an experimental study can be planned. Okay? So those are the reasons why we need to do descriptive research. So far, are we good? Can you follow? I hope that everyone can follow. Now, descriptive studies can be classified into different dimensions. No, there are a lot of research designs that we can talk about, but I want to uh, put emphasis, no, on these descriptive studies and the based on the dimensions, okay, na maka-classify sila. Kapag ang basihan natin ng dimension ay yung measurement ng variables, okay? Ay yung measurement ng variables, yung independent and then the dependent variable, it can be classified as a retrospective research or a prospective research. Later on, we will discuss in detail what's retrospective, what is prospective research. Okay? We also have what you call, no, researches, no, na naka-classify based on the time frame dimension. Sa time frame dimension, dalawa ang maka-classify nating research. Either you do it cross-sectional research or you do a longitudinal research. But if our focus is on epidemiology, no, this is especially useful, no, in health researches. No, it can be classified according to the prevalence, okay, prevalence studies, or it can be classified by using you can do also an incidence study. Later, i-discuss din natin in detail kung ano ang prevalence at incidence studies. Okay? Now, let's go on the first research design, okay, which is your retrospective research. Retrospective research is actually a reflecting research. No? A reflecting research where you try to review a certain outcome, re-reviewin mo kung bakit siya lumabas and pointing back to a presumed cause. Okay? So it's like you link the existing present, no, to the past, no, to the past factors that made that outcome. Okay. Because you are interested, no, in a present outcome and you attempt, no, to determine the antecedent factors that caused it. Mahirap intindihin kapag walang example. So lagyan natin ng best example to reflect, no, retrospective research. We all know that lung cancer, one of the antecedent factors of lung cancer is tinatawag na smoking. Kasama ang smoking doon. May iba, may exposure to carcinogens, meron din na family history, no, and other factors. But to know lung cancer's cause, no, ng smoking, no, paano kaya nag-arrive into that conclusion? For example, if you will think normally, okay, or if you will think the usual manner, you will say that to find out whether smoking causes lung cancer, what we do is to force someone, no, to smoke. Smoke ka, isang pack per day, no, hanggang matapos. Pinilit mo siyang mag-smoke, no, which cause lung cancer, no? So that way you establish smoking leads to lung cancer, no? But then again, my question is that ethical? No? The answer is no, because you forced someone, no, instead na hindi niya makuha yung sakit na lung cancer kasi hindi naman talaga siya nagsusmoke o wala naman siyang planong mag-smoke o kaya mahina lang siya mag-smoke, pero pinwersa mo ng mag-smoke ng 1 pack per day, that's unethical because you exposed him or her to harm. So to avoid, no, that dilemma, we conduct a retrospective research. Okay? A retrospective research is that we identify those who has lung cancer, no? Those who have a lung cancer, identify mo sila. And then trace back, no? What are their practices that cause, or what are their lifestyle, no? Kung ano yung mga lifestyle nila that led them to get lung cancer. So magkakaroon ka ng mga questions about them, no? You will ask them something, no? It's like you're asking them to describe their life, no? prior to them getting the lung cancer. And during that course of study, no, mapipinpoint mo na mayroong ganitong factors, no? So that's how the retrospective research. It's like reviewing the outcome, which is yung case natin, yung lung cancer, going back doon sa mga nangyari sa kanya or na-expose sa kanya or whatsoever. So that's your retrospective research. You're trying to look back, no, on a certain outcome and identify what caused that. Okay? So baka sinasabi ninyo, I'm just joking around about the retrospective research. Here is an example of a retrospective research, no, that explored, no, the link between smoking and lung cancer. So you can access this, no. Okay, this one is in rural prefecture in Japan. You can access this research, no, using this DOI. Okay, pwede nyo siyang mahanap, or type nyo yung mismong keyword and try to read, no? And it says there that smoking is really related to lung cancer. Okay, so what he did is a retrospective research. Binalikan niya yung mga habits, no, ng mga patients or people, respondents with lung cancer. Okay? So we're done with retrospective research. Yun yung binabalikan. No? But the opposite of a retrospective research is what you call your prospective research naman. So kanina, looking back ng retrospective, ang prospective research, it's looking forward. No? When we say prospective research, okay, it's like you try to observe a certain cause, no, if it will manifest, yung hina-hypothesize nyong outcome. Okay? You start with a presumed cause and move forward in time, okay, until you observe the presumed effect. Okay? Now, prospective researches usually take time to complete, no? Because of prolonged observation na kailangan, no, para makita yung presumed effect. So if you're planning, no, to do a prospective research, no, dapat simulan niyo yan nung first year pa kayo. Okay. So I do not suggest, no, doing prospective research, no, with the time that you have, since if you will be graduating, because you need, no, a lot of time, no, for prolonged observation para lumabas yung presumed effect. Okay? So para mas madaling maintindihan ang prospective research, we try to look, no, into this diagram, no. This diagram says whether exposure to rubella virus, no, causes congenital anomalies, no, sa mga fetus. Okay? So when you observe, no, a certain factor, no, and until such time na mag-manifest siya ng congenital anomaly. Take note, no? Take note that yung exposure or yung presumed cause na sinasabi natin, hindi dapat ini-introduce kasi nga sabi nga natin descriptive, di ba? So dapat pag descriptive, you do not introduce something. You just explore or explain or describe or monitor a presumed cause, no, of exposure to rubella virus, and then monitor those who are exposed, no, if they will manifest, no, congenital anomalies, no, doon yung mga buntis na nanay sa kanilang mga anak. Okay, so that's the presumed that's how prospective research go, no. Iobserbahan mo, no, doon sa course, no, ng research time frame mo kung magba-manifest ba ng ng effect, no? Yung in-identify mong cause. Okay? So baka sinasabi nyo rin, sabi-sabi ko lang ito, meron po talagang study, no? Na finalo ang prospective research. Yun nga lang dito naman sa rubella vaccination naman. Okay? Which was done in Rio de Janeiro in Brazil. No? This one is 2001 to 2002. So notice no the time frame, 2 years niyang ginawa yung research. Okay? Hindi 1 year ha kasi that's the difference. Pero yung range will be from 2001 to 2002. So 2 years niyang ginawa yung kanyang research. Okay? Kasi nga you need to measure, you need to observe, no, the outcomes repeatedly. Uulit-ulitin mo so that you'll find, no, a conclusive evidence for that research. Okay, so that's an example, no. You can access this research through this DOI, no? Okay. So far so good.
Yes, Doc.
Okay, sige. So we're done with studies, no, that were classified based on how we measure or how we study the independent, no, and the dependent variables. Okay. Now, we will now proceed, no, to another type of descriptive researches, no, that talk about cross-section, that talk about the time frame of data collection. No? There are two modes, no? Yung tinatawag na cross-sectional research and the longitudinal research. Okay. When we say cross-sectional research, these are researches, no, that captures, no, data from a single point in time. Okay. You try to understand a certain phenomenon, no, by getting a piece of that data, no, over the course of the phenomenon itself. Like for example, no, you're trying to understand the professional attitudes of pharmacy students from first year to fourth year. So you do a cross-sectional research, no, kapag ka kumuha ka ng one piece, no, hindi chicken joy, one piece of that data from that particular year ng mga estudyante, another piece of data from one point, no, of the enrollment period of that group of student, yung second year, ganun din sa third year, ganun din sa fourth year. No, so it's like getting a cross-section, di ba sa anatomy, pag sinabing cross-section, sa isang mahaba, isang part lang, no? Isang part nung hati, no? It's like getting a single piece, no, of that data out of the whole process. Okay? Now, the best example of cross-sectional research are your surveys, no? I know you have you've been watching the news na may SWS survey results na nagsasabing mataas ang approval rating kay President Duterte, etc. Those are cross-sectional studies. No? Those are cross-sectional studies because they get a piece of the approval only at a certain point in time. Okay? Basically, cross-sectional researches ang advantage lang talaga niya is economical, no? Kasi madaling matapos, maliit ang sample size na kailangan, hindi mo kailangang tumawid or magbabad, no, sa data collection kung tawagin, to immerse yourself totally in data collection, but you get only a piece, no, of that data every now and then, only at a certain point in time. Okay? So, it's easy, yes. It's economical, yes. But conclusive, medyo mahirap. No? Bakit? Kasi getting a piece, no, of that of a data of a large process, no, is actually hindi tayo sure, no, if that is really the representative response of the whole. Hindi natin sure. No? Plus, there are extraneous variables. No? Extraneous variables that affect the current time. No? For example, you try to uh, know, no, whether a certain smoking cessation program is effective or not, no, by getting a small portion of that data. So for example, from June up to now, you're implementing a smoking cessation program. Now you want to know if whether that smoking cessation program is effective or not by doing a survey. Yung sinasabi natin cross-sectional research. Yung survey, let's say for example, you get the survey by July. No? During July, no, naalala mo that there are enrollments na ongoing, no, online enrollment na nangyayari. Ngayon, ang mga estudyante nung enrollment makakabasa ng reminder, no, regarding their behavior, no, regarding their student handbook, no, kasi papipirmahin kayo doon na we need to abide by the rules and regulations set by our student handbook, no? And nakapaloob doon yung smoking cessation, bawal kang manigarilyo. Okay? So getting a sample from that time doesn't tell you whether the smoking cessation program is really the cause of altered behavior. Kasi may kasabay ka na event na enrollment na nagsasabing bawal kang manigarilyo. Something like that. So that particular incident makes it difficult for us to interpret or infer whether our program is really the cause, no, of the change in behavior. Okay? So, ganun din kapag nag-o-observe ka ng isang bagay at one point in time, no? Baka may ibang factors na nakaka-affect doon na pwedeng mag-alter sa totoong meron, no, doon sa isang prosesong iyon. Okay? So, yun na nga. Ito yung example natin kanina, no, yung cross-sectional research on professionalism, no, ng pharmacy students from first year to fourth year. Kuha ka ng slice dito, kuha ka ng slice dyan, dito, dito. No? Cross-sectional research. But then, it doesn't tell you, no, yung kabuuan ng proseso ng first year, yung kabuuan ng proseso ng second year, ng third year, at ng fourth year. Ganun din po, hindi mo rin alam kung pare-pareho ba yung nangyari at naranasan ng first year, sa second year, sa third year, sa fourth year. So, yeah, it's difficult to prove, no? But it's doable, no? It's doable. Okay? So, here's an example of a cross-sectional study. No? This one is published in Saudi Pharmaceutical Journal. It's available in Science Direct. No? This is an original article about continuing education in pharmacy, a cross-sectional study exploring pharmacists' attitudes and perceptions. Okay, if we critique these attitudes and perceptions, kapag cross-sectional lang ginawa mong study, these attitudes may be affected by a lot of factors because you only get 1 point, no, or 1 data point for the attitude, no, and the perception, nag-iiba-iba rin yan. So ang hirap din i-conclude, no, ang hirap din i-interpret ng mga cross-sectional study. Again, you can use this. I'm not saying na you don't do cross-sectional study. Now, what I'm saying is that you have to be prepared to interpret your findings, no? To make sense out of your findings in cross-sectional studies. Okay? Now, the counterpart o yung kabaliktaran on the other end, no, of researches, no, when classified in time frame are those taking on a longitudinal design. No? When we say longitudinal design, di ba kapag ka sa globe, ang key term here is that pag longitude, yung pahaba, longitude na linya, yung pahaba ng linyang ng globe. No? Longitude, so pahaba. So when we say longitudinal research, you do a research in prolonged periods. No? In prolonged periods. Okay? You collect data at more than one point in time over an extended period. No? Okay? So, wag malilit. Ibig sabihin po nito, longitudinal research designs are those researches that used to observe, no? Are used to observe a group of people, no? And the outcomes that that we want to, and the manifestations that we want to learn from them, yun yung obserba natin in longitudinal research. Yun nga lang, yun nga lang, don't be confused, no, kapag sinabing longitudinal and prospective research. Kasi di ba kanina, sa prospective research, sinabi natin na prolonged period of time din ang observation. No? Prolonged period of time ang observation. Sa longitudinal, ganun din. Prolonged period of time ang data collection. Yun nga lang, ang pinagkaiba ng prospective sa longitudinal research, kapag ka-prospective, nagsa-start ang data collection mo after a certain characteristic has been experienced by your respondents. Okay? That's prospective. Kapag pumasok na yung gusto mong maobserbahan, no, doon sa respondent mo, doon ka magsa-start ng data collection, no, until such time na mag-manifest siya ng outcome. Unlike kapag longitudinal research, no, pag longitudinal research, hindi mo obserbahan yung tao kapag pumasok na yung presumed cause mo, no, or yung presumed na X variable mo, no? Obserbahan mo siya from the start kahit na meron ng effect sa kanya yung X variable, no, hanggang such time na mag-manifest siya. So suma total, ang scope ng longitudinal research ay mas mahaba, no? Longitudinal research are wider in scope because binabalikan mo, pwede kang bumalik sa pinagmulan nung variable mo. Okay? Now, longitudinal researches can be useful in observing behaviors, no? Thoughts, emotions, even developmental trends, no, yung paglaki ng bata, no, paglaki ng pagtanda ng tao, no, development of side effects, okay? Those are coming from longitudinal researches, okay? Even consumer patterns and preference, no, yung marketability, no, and market consumption ng mga mamimili, ginagamit ang longitudinal research. So, yun nga, balikan natin yung example natin kanina, no? On the professionalism ng mga pharmacy students, okay, from first year to fourth year. If we try, no, to observe, no, the students on their professional attitudes from first year, no, correct me if I'm wrong, no, kung hanggang 4 years ba ang pharmacy? So anyway, I'm assuming it's a collegiate level, no, from first year to fourth year.
Yes, Doc. 4-year po ang
Okay.
BS Pharmacy.
Ang may fifth year, yun yung Pharm B.
An additional 2 years po for the Doctor of
Okay.
Pharmacy po.
Okay, additional 2 years. So from first year to fourth year, kung obserbahan mo yung mga estudyante from first year na sila ay pumasok hanggang fourth year, that's a longitudinal research. No? That way, you get a more conclusive evidence of their development. No? Sabi nga natin kanina, ginagamit ang longitudinal research for developmental trends. No? Yun nga lang, longitudinal research is time-consuming. Time-consuming. You have to, kung first year to fourth year ang oobserbahan mo, yung paglago ng estudyante from first year to fourth year, yun yung oobserbahan mo. 4 na taon mo rin gagawin yung research mo. Okay? So, if you're doing an undergraduate research, no, na requirement for graduation, baka hindi kayo matapos, no? Naka-graduate na yung classmates nyo, no? Naka-graduate na sila, ikaw nagre-research pa. So you might not want to consider this. But in the future, syempre kailangan mo rin consider if you want to explore more, no, in doing your careers in research. Okay? So here's an example, no, of longitudinal study. Ito sikat to, no, yung the Seattle Longitudinal Study, where or also termed as Seattle 500 study, no, wherein it explored, no, prenatal habits ng nanay sa human development ng mga pinanganak nila, no. So human development meaning hanggang sa sila ay tumanda, no? Hanggang sila ay tumanda. So napakatagal ng study na to, and it concluded in 2004 or 2000 and was published no 2006, no, in this based on this information. Anyway, so hanggang they tried to understand the development of a person based on the prenatal habits of their parents. So mahaba-habang panahon ang ginugol nila, no, to observe, no, a group of people, no, something around 500 respondents, no. Okay, and that was conducted in Seattle. Now, so far we're done with the two dimensions, no. The third dimension is prevalence studies. When we say prevalence studies, these are studies na that we do, no, to determine the how prevailing, no, a certain condition is. Like for example, disease, no, behavior, smoking, no, at a particular point in time. Okay? So it's actually associated with cross-sectional study kasi kumukuha ka nga lang ng piece, no, ng prevalence, no, at a certain point in time. Okay? So you're taking a snapshot, no, of the population, no, to view the disease or the condition para lang ma-describe mo siya. So pag prevalence studies, it's more like cross-sectional design. Okay? Now, prevalence studies are primarily done by getting the total population in risk, no, and diagnose it using a tool, no. You diagnose them and identify the number of cases with the condition or disease at a given point in time dun sa kinuha mong sample, no, and multiply it by K, no, or the number of people na gusto mong ilagay yung or i-proportion yung prevalence mo. So for example, no, you want to explore, no, the prevalence of depression among students, no, during this pandemic. So let's say for example, ang population mo will be the Adamson University students, and you want to know whether the depression is how prevalent is depression during this time of pandemic. Okay, so you will consider all students at risk. No? For example, 500, no? 500 yung estudyante ng Adamson University, no? Which is konti. Okay, 500, and then they are at risk of depression. Out of this 500, you administer a depression questionnaire, no, to diagnose whether they are experiencing depression or not. So when you administer this tool to them, pinasagutan mo sa kanila, you let them answer, you get 80, no, of the actual case, no. You sumagot nung when you tabulated the results, you found out that 80 of them have the actual case. Okay? So by the formula of the prevalence rate or point prevalence rate kung tawagin, you divide, no, the actual case, which is 80, by the number of person or people or the population at risk of being a case. So 80 divided by 500, and since it's in hundreds form, no, nasa 100 yung inyong denominator, ang inyong K is per 100 people. Pwede yan by 1,000, no? per 1,000, or per 100. Can be expressed as per 100 or per 1,000. Now, sa computation, 80 divided by 500, lumalabas na sa 16 per 100 students ang nakakaranas ng depression sa Adamson University during this time. So that's your point prevalence study. You get a picture, no, kung gaano karami ang merong depression during that time. Okay? Or during the time of pandemic. Okay? And on the other hand, no, meron din naman tayong tinatawag na incidence studies. No? When we say incidence studies, these are studies used to measure the frequency of developing new cases o yung pagdami at paglago ng mga bagong case. Now, incidence studies are associated with longitudinal designs. Kasi uobserbahan mo yung mga bagong case, no, after a year na gumawa ka ng prevalence study. Okay? So the formula is here, no? The number of new cases or with the condition or disease, no? Or at the given over a given time period, and the number at risk, no, of becoming a new case, no, or those who are free of the condition, no, at the outset. For example, balikan natin yung assessment natin kanina. Sabi natin, there are 80 actual cases, no? Therefore, ilan yung walang case? 80 minus 500, that's around 420. So after a year, let's say for example, you measured it this year, 2020. And after a year, in 2021, you try to assess whether kung dumami ba o hindi. So you're doing an incidence study. So out of that 500, no, those who do not have the case or who are not depressed, no, yung 420, nalaman mo nung nag-reassess ka, mayroong 21 bagong case, no? 21 new case. Okay? So that 21 divided by those na walang depression during ng outset nung inyong data collection, 21 out of 430, that's around 5, okay, per 100. So lumalabas, mayroong 5 bagong incidents, no? Sorry. May 21 na bagong incidents, no, ng depression after a year. After a year of having the pandemic, no? Mayroong 5 bagong case out of 100 students. So that's how you do incident studies, no? Para ma-locate mo in terms of dami, no, yung mga cases na nag-o-occur. Okay? So that's one study in health science that you may want to consider, no? The number of cases. Okay? So you may explore the number of cases ng depression, yun na nga, sa among students, pwede rin naman among indigenous group of people during pandemic, etc. Na may bearing, no, in health sciences. Okay? Now, we're done with the 3 major dimensions of descriptive studies, no? 3 major dimensions of descriptive studies. Okay? Now, some people would say, no, that research or descriptive researches are quantitative in design or quantitative in nature. Ibig sabihin, descriptive researches, according to some people, descriptive researches are only quantitative research, no? Ibig sabihin, kina-quantify lang, mini-measure by numeric, no? By numbers, okay? By numbers, and you just have to limit it that, no? But I would like to disagree with that because sabi nga natin sa definition natin kanina, descriptive researches are also there, no, to know the full extent, no, of a phenomena ng isang pangyayari or ng isang bagay. So how will you know the full extent if you will limit yourself to numbers? No? Numbers sometimes do not give meaning of the experience or the phenomena. No? So we try to remove that, we try not to limit ourselves with na dapat ang descriptive quantitative lang. No. We don't want to limit you. You may explore also qualitative researches, no? Because qualitative researches by nature are descriptive researches. They describe something out of the new. So I would like to present to you some researches na based, kasi mayroon tayong five major approaches, no, in qualitative research, no. Isa yung ethnography, meron tayong tinatawag na phenomenology, meron din tayong tinatawag na grounded theory, meron din tayong tinatawag na historical research, and meron din tayong tinatawag na action research, no. So when we say ethnography in health science, okay, we try to, pag sinabing ethnography, this is the study of culture, no? Studying the culture, no? The ways of the people, okay? And one of the ways of the people is their health belief, right? How they do their health, no? How do they act when they are sick? How do they perform, no? How do they choose the medicine that they want to take, no? Lahat yon are affected by their culture and their belief. Okay? So it's also important to explore this aspect when doing descriptive research. Okay? You can do an ethnography in health science. So for example, this one is an ethnographic study of medication reviews in Ontario, Canada. Okay? What did they find out? Let me share that their study highlighted the importance of local structure of community pharmacy practice and the clinical aspirations of pharmacists in the delivery of medication reviews. No? And how did they arrive into this conclusion? No? They did a lot of observation, they did a lot of interviewing, they did a lot of immersion with the community. No? Kasi ang ethnography, it involves, for you to understand the culture, you must live it. No? You must live na yung how the people are doing, to know what their what's the construct of health, kung ano yung konsepto ng health sa kanila. So that's one way to explore or to describe a certain problem, okay, using ethnography. Okay? Another type of research, qualitative research that can describe a phenomenon is yung tinatawag nating phenomenology. When we say phenomenology, this is qualitative research that focuses on the lived experiences of the lives or of the experiences of the people who experience that phenomenon. For example, dito sa picture, sa study na sinite ko, the lived experiences ng mga nurses who cared for dying pediatric patients, mga pasyenteng na mga matatandang pasyenteng ng mga bata na namamatay, or nanghihingalo. Okay? So this one is a lived experience, You try to explore what's the meaning of the experience among nurses, among that group of people. You try to understand what's within them. You try to describe what they feel, about a certain phenomenon na experience nila, which is caring for dying pediatric patient. And by looking at the conclusion of the study, malalaman natin na mayroong mga tema ng experience na iyon. Gumagawa kasi ng thematic analysis sa phenomenology. At ano yun? Well, some nurses experience empathy. Some of them experience feelings of ambivalence, inevitability, hindi maiwasan. Okay? Inspiration, relationship, self-preservation, and sorrow. Okay? And these themes demonstrate a connection formed between the nurse and the patient. So pwede 'yon, no? So you can explore that also, no? Kapag kayo ay in practice, no? If your interest is in the lived experience, no, of your clients or your patients, you may do a phenomenology. Okay? Another type of qualitative research approach is yung tinatawag na grounded theory. No? A grounded theory is a qualitative research where you try to develop a theory inductively. Pag sinabing inductively, kumukuha ka ng idea from specific situations and then connect it, no, to develop a theory that will explain other similar that will explain other the occurrence, no, of other similar na pangyayari, no, na nag-occur sa ibang setting, no? It's like developing your own theory, no? Grounded theory. Okay, so you try to understand, you do a lot of you try to understand your data by collecting, observing, no, asking, interviewing, no? So a lot of descriptive methods, no? A lot of descriptive methods ang ginagawa mo. So grounded theory is nagagamit actually rin in health science, no? For example, dito sa research na to, this one is done, or a grounded theory done by grading those, no, yung mga residente, mga doktor, no? And how they would react properly in the in evaluating their performance, no? And one of the conclusions says that the residents think that the feedback, yung residents na sinasabi ay yung mga residenteng doktor, think that the feedback in the assessment tools is the most important proof to demonstrate their performance, whereas program directors scarcely use this feedback to form a judgment about residents' performance. So, ibig sabihin, they develop, no, a way of understanding, no, on the behavior of a certain group of residents. If we will reflect on this, no, we can also use grounded theory, no, in health, in other subjects in health science, no, by looking at the ways, no, our clients, no, behave, no, kapag sinabing vaccine, kapag sinabing ganito, no, we try to if we want to go back, no, dun sa fear ng dengvaxia, we can use grounded theory, no, to describe the phenomenon of the fear of vaccine nung dengvaxia. Okay, so you can use that methodology, no, yung grounded theory, to explore that and the likes, no. Kung gusto niyo sa COVID-19 on how people react, pwede rin naman, you can achieve, no, you can achieve it by doing a grounded theory. Okay? Now, another approach in qualitative research is yung tinatawag na historical research. Okay? When we say historical research designs, these are researches, no, that looks back before us, no, what happened before. Usually, we try to recover, no, data, no, or information from surviving records, no, regarding that history. May babalikan ka, no? Yun nga lang, the problem with historical research is that the surviving records, no, may or may not be complete, no? May not be complete. So data may be altered, data may be fabricated, no? Yung validity ng data may be affected, no? So we try to add, no, other methods, no, in historical research, no, like hindi bukod sa pag-go back sa existing record, we try to do interview ng mga taong naka-experience nung ganong history, no? We try to go back to people who experienced, no, or who initiated change, no, for that certain history. Okay? So, here's a good example, no, yung of a historical research that is made actually into a book. No? You can You can see this in UP Press, no? Yung, the book of Maria Mercedes Planta, which is about the traditional medicine in the colonial Philippines. No? In this paper or in this book, she tried to go back, no, in history, no, to find out what are the traditional medicine, no, and their beliefs, no, na nakakabit doon sa mga medisinang iyon na naka-attach, no, and try to explain what's in it. Okay? So historical researches are not meant, no, to just describe the history. Okay? It's also a way to develop, to develop and synthesize new solutions for the future. Historical research are not there because wala lang, gusto ko lang ma-describe yung history. But rather, you use this to find better solutions based on what happened before. Another one, and the last one, I think this is the last methodology na pwede kong masuggest, no, when you do research, no, is yung tinatawag nating action research, okay? Or participatory action research, may tinatawag na sinasabing gano'n. Wherein you try to involve the community, okay, to identify their problems, no, and mobilize their own resources for their own sustainability. No? It involves, no, your community, okay, trying to help them describe their problem, hence descriptive research, no, and try to ask, no, if they can find or develop their own solutions. No? So that's your action research, no, in health sciences. So here's an example. No? Noong 2007, the Journal for Social Action in Counseling and Psychology published a paper about health inequity and social injustice for the ITAS in the Philippines. Critical Psychology in Action. So in this paper, they tried to identify the health belief, no, the perceived inequity, yung hindi patas, no, pag-receive ng health services ng mga ITAS, okay, and even the social injustice that they are experiencing, no? And tried to identify mechanisms within the community on how to address these problems. No? So it's like a two-pronged project, no? Kapag ikaw ay gumawa ng action research, inalam mo kung ano yung may problema, hence you develop the knowledge, and nag-propose ka ng solution, no, with the help of the people which help your target community. No? So those are the two. Okay? So those are the two-pronged effect, no, of doing an action research in health science. No? I think also the work of Dr. Catublas is also an action research in itself, no, because she identified, no, what is needed to be learned by students, no, para doon sa mga pasyenteng or with hard of hearing, no, and she helped develop it with the help of the people, no, who are hard of hearing, and then she made a manual. So it's an action research in itself, no. She proposed a solution based on the community's inputs. So that's an action research. You can also do that, no, in considering your research, no, or your output, no, for your research class. So I think this is the last slide for my talk for this afternoon, and I'm sharing my references here since I'm a nurse, no. Most of my resources or references are in the nursing profession, but you can find wisdom naman, no, in terms of you can find knowledge and wisdom in these books, no. You can also consult other books, yung health researches, no, okay, and the likes, okay. So if you have any if you want to read more or something, find something more about me, no, you can always access, no, my ResearchGate account. No? I have a ResearchGate account. You can see there my works. No? Mostly or most of them are are descriptive researches. Most of them are descriptive researches. You can access them there. And if you want to learn more about you want to learn more about research, no? I'm also teaching research. You can access my YouTube channel, and you can find there my videos on lectures, no, on research naman. Yun nga lang, it's in nursing kasi. But sabi ko nga, the paradigm of research applies to all profession, no? Applies to all profession. And since similar naman tayo ng profession, we are in the health sciences, no? You may find it useful. Okay? So with that, I end my presentation. Thank you for listening. And I give the floor back